Hi everyone, welcome to my channel. If you have tuned in to watch this video, it's likely you have just had your baby or you are expecting your baby. So I say congratulations to you or congratulations in advance. So I'll be talking about postpartum care, what to expect postpartum, and how to deal with the various challenges that come up after you have just had your baby. My name is Olufumi Odumoagun and I'm a homemaking enthusiast. I share different types of homemaking content that can change the trajectory of your home for good. So watch this space. So postpartum recovery is the healing that takes place after you have just had your baby. After you've just had your baby, it takes a while before your body goes back or returns back to its former state before pregnancy. So I'll be talking about different things that would happen to you, to your body after you have just had your baby. Some of these things we are not prepared adequately for them, and we don't even know about them in some cases, especially for new parents. So the first thing I'll talk about is bleeding, vaginal bleeding. After you have just had your baby, you are going to bleed for a while, sometimes for up to 6 weeks. So most times people bleed between 4 to 6 weeks after they have just had their babies. And sometimes it might last longer or shorter than this. And let me shock you, most people do not know that if you had CS, you will still bleed your vagina. So even if you had cesarean section or you had a vaginal birth, expect that you are going to have vaginal bleeding. So all those 9 months menstruation that you skipped, you're going to have all of them together after you have just had your baby. And I will say that when you have just had your baby, the first few days are usually very heavy, but with time it gets to normal flow, and then with time it becomes very light, more like a staining kind of menstruation. So for the first few days, you want to invest in heavy maternity pads. If you find the ones that have wings, please do. But at this time, your priority is your comfort and hygiene so that you can feel good and feel comfortable after you have just had your baby. I would also mention that this period is not the time to use tampons or inserts. You want the blood to flow out seamlessly and as easily as possible. However, if you experience excessive bleeding in which you have more than one fully soaked pad in less than 1 hour, you should speak to your doctor about it so that they can evaluate you in case there might be deeper problems than just the regular bleeding. The second thing I want to talk about is uterine contraction. So after you have had your baby, it takes a while for your uterus to return back to its normal size. Most times it also takes about 4 to 6 weeks, and that is why after you have just had your baby, you might still look like you still have like 5 to 6 months pregnancy in you. So please don't be shocked. Most new moms don't know this. They think that after having their baby, their tummies will go flat. No, it will take a while for your tummy to shrink back. No matter what you do, it's going to take a while for your tummy to shrink back. So accept this. Also, I need to mention that the uterus contracts quite a lot during this period, and this can be a bit uncomfortable, but it shouldn't be excessively painful. So if you are experiencing excessive pain, then you should speak with your doctor as well. I need to also mention that breastfeeding during this time helps your uterus to shrink back quickly to its right size. And that is why during breastfeeding, you might actually experience uterine contraction. So if you experience any of this, do not be afraid. It is nothing to be worried about, except it is excessively painful. The third thing I want to talk about is the healing of your vagina or your cesarean section stitches. So I must also mention that newborn moms must know that after having their baby, they would most likely experience pain at the vagina area or on the stitch you got during cesarean section. After CS, when you cough, when you laugh, you might experience pain, and this is absolutely normal. And you can prevent this by holding your tummy in a careful way while you cough and laugh. And you have to also cough and laugh gently so that you don't cause yourself too much pain. And also for vaginal delivery, you will most likely experience pain after you have just had your baby, and this might take from between 2 to 6 weeks as well, especially if you had a tear. And most times this pain becomes more excruciating when you need to pee. And how to comfort this? Firstly, it's important to know that it will eventually go. Your body will heal and go back to its normal state. Knowing this in itself is comforting. You can also use a seat bath if your doctor says you can go ahead with that. But if your doctor says it's okay, it's one of the ways that you can reduce the pain and discomfort that comes with vaginal pain. Also, I would say, in addition to this, if you have been discharged with any antibiotics or pain relief, please use them as prescribed by your doctor, because this will really help you. It will help the stitch to heal faster, and it will also help to reduce the pain that you experience during this period. For people who have had vaginal delivery, using ice packs to reduce swelling in that area can also help you to relieve the pain that you experience. The fourth point I will share is constipation and hemorrhoids. So most times after you have just had your baby, you are likely going to be constipated or experience hemorrhoids. So it's important that you are aware of this and prepare ahead of this. How can you prepare? Make sure that you stay hydrated after you have just had your baby. Drink enough water. Drink water as frequently as you can, and also eat fiber-rich foods. I believe that one of the foods that we take after delivery in Nigeria is taking pap. Pap is excellent and can help you to really relieve the chances of you having constipation and hemorrhoids. So you want to invest in this because of the fiber and the water content as well. If this is not helping, you might also want to get stool softeners so that your stool will be softer and easier to pass. The fifth point I want to talk about is very, very important. Postpartum depression is real, and you want to handle this as importantly as you can. So there's something called baby blues and postpartum depression, and they are similar. The only difference is the duration of time. After your baby, you might experience mood swings where one moment you are really sad and another moment you are happy. You might feel hopeless, you might feel sad, you might feel like you are not a good parent enough. You might feel that you are not even worthy to have a child. You might feel guilty for feeling tired or stressed out. Trust me, these feelings happen to almost everyone at one point or the other. But when it becomes excessive or lasting for too long, that is called postpartum depression. When it lasts for more than 2 weeks, it is postpartum depression, and you should begin to seek medical help. However, if it's just within the first 2 weeks, you would most likely adjust, and that is called baby blues. You might not need to speak with your doctor regarding that. So how do you deal with postpartum depression? The first thing is to surround yourself with people who are very supportive and helpful. I know that this is easier said than done, but joining a support group online, connecting with other mothers who have just had their babies, your antenatal friends will really, really help you in this period. Trust me, this was something that really helped me. I had friends around me who had just given birth, and I will always communicate with them regularly. And then another thing is to accept help. When people want to help you, let them help you. Don't try to do everything all by yourself. However, if you have done all of this and you're still feeling hopeless, you're still feeling not interested in activities that you like, fatigue, lack of motivation, you might want to speak with your doctor. And when you see your doctor might recommend that you also see a therapist. In this process, they might give you medications and offer you therapy. This will definitely help you feel better. Please do not keep this to yourself, especially when you begin to have thoughts of killing your baby or killing yourself. Do not keep it to yourself. Run to your doctor or speak to a therapist. The sixth thing I want to talk about is breastfeeding. When you have just had your baby, you would most likely be breastfeeding, and this affects a whole lot of things in your life. You won't be dressing the way that you dress. If you're a nursing mom, you won't be able to wear jumpsuits or wear long flowing gowns. You want to invest in clothes that will really help you to breastfeed, clothes that you can easily raise in public and give your baby easy access to the breast. You also want to invest in nursing bras and nursing pads so that you can soak up excessive milk that might be coming out of your breast, so that you don't soak your clothes or get embarrassed in public. Also, you might want to watch my video on getting your baby to latch properly. This will really help and save you lots of troubles. And as I mentioned mentioned in that video, I'll recommend that if you can, try as much as possible to breastfeed your baby, because breastfeeding will help your body to heal easily after you've just had your baby. Trust me, breastfeeding releases hormones that can help you to relax and feel better about yourself, and even sleep and rest better. So you want to breastfeed as often as you can. Also, when you breastfeed often, you would get more milk supply, which is also very beneficial to your baby. I need to mention that while breastfeeding a newborn, you might need to get breastfeeding creams or nipple creams to prevent very dry or irritated nipples. So you want to rub this on your breast every now and then, or as often as you need it. Also, if you are experiencing engorgement, you might want to do warm compress or cold compress on your breast. So before feeding your baby, you can do a warm compress on your breast. That you could soak a towel with warm water and massage your breast with it. That will help you to feel better. And after breastfeeding your baby also, you could do a ice or cold compress on your breast. This will help you to feel better. I must also mention that if you are experiencing fever, chills, red or swollen breast, you might be having mastitis, and you may need to speak with your doctor so that they can offer you the necessary treatment that you need in this period. The seventh point I want to talk about is resting and getting enough sleep. I know that it is no news that when you have just had your baby, sleeping at night might be very difficult. So there is this popular advice that we all know, but I will say it again just for emphasis. As much as you can, get sleep when your baby is sleeping, and as much as you can, let people help you with your baby so that you can also sleep. For example, if you have people that can take your baby's bath, let them do it while you rest and sleep. The eighth point I want to talk about is your spiritual discipline and devotion. Trust me, when you have just had your baby, you might be overwhelmed a bit and be tempted not to do your regular routines of praying and reading your Bible. But I will tell you that if you pull away from this for too long, it might eventually bounce back on you and you start feeling frustrated. So I would recommend that as much as you can, try to pray regularly, read your Bible, reflect, journal, do your daily routines that helps you to keep sane, because you really need them in this period. Skipping these things might feel like a little comfort at the time you are skipping it, but on the long run, if you do them, they would be more helpful for you. So the ninth and the final point I will give is know when to see your doctor. I have highlighted this under different points, but I will still say it again. If you are bleeding excessively or you see large clots of blood in your pad after your delivery, see your doctor. Tell your doctor. If you are experiencing fever or your body temperature has risen above 38 degrees Celsius or 100.4 degrees Fahrenheit, call your doctor so that they can access you properly. If you are experiencing severe abdominal pain that is unbearable, call your doctor. There might be an issue that they need to attend to promptly. Also, if you see signs on your CS stitch or vaginal stitch that are abnormal, like pus, excessive swelling, or redness, you want to call your doctor and show it to them as early as you can, so that if there is a problem, they can catch it and treat you as early as possible. And like I said earlier, if you're experiencing postpartum depression that is lasting for more than 2 weeks, call your doctor so that they can assess you properly and offer you treatment. I hope that this video has helped you in one way or the other. If you are a mom and you have experienced any of these symptoms I mentioned, tell us in the comment section and tell us how you were able to deal with it. I hope this video has been helpful in one way or the other. Please kindly like the video, give us a thumbs up, and subscribe to my YouTube channel, because you will get lots of helpful content that would help build your family and your home. Thank you so much for watching, and have an amazing day. Bye.